It is with great pleasure that today we are together not only to launch these important programs, but to celebrate a great milestone of huge success and impact, which we are going to share with you in detail from 2019 until now, and the future plans for the next 5 years to continue our mission of building healthcare and media capacity, transforming patient care, breaking infertility stigma, and supporting girls' education in Zimbabwe. We are here today to meet our Merck Foundation Zimbabwe alumni and Merck Foundation Media Recognition Awards winners, hence to follow up and discuss our joint programs. Dear Merck Foundation Zimbabwe alumni, I'm glad to meet and acknowledge all of you, the future healthcare experts of Zimbabwe, and also the winners of Merck Foundation Awards, who are our health and social community champions to break infertility stigma and raise awareness about other health and social issues, such as girl education, ending child marriages, raising awareness about diabetes and hypertension and the ongoing coronavirus, and more. I'm proud of each one of you. Keep up the good work, ladies and gentlemen.
We provided around 100 scholarships in 2 years, maybe 2020 and 2021, and the rest of the coming this year, for doctors from Zimbabwe in specialties that been mentioned now: diabetes, endocrinology, cardiovascular, preventive, respiratory care, and acute care, and oncology, which is very, very important because we made history in that, but providing the specialty of the first oncologist in many subspecialties, but also fertility and embryology, and lately sexual and reproductive care, which is very important for women's health. It was very important, and actually the biggest number of scholarships went to these 3 specialties to complement the More Than a Mother campaign, to be able to empower infertile women and infertile couple to have access to infertility treatment. This year, we approach Her Excellency to provide scholarships, which she's going to announce, for young girls who is highly performed but underprivileged to continue their school fees and so on, so they can continue their education and until they reach their potential, fulfill their dreams, and be a good or a strong force in the community and society, having stronger, healthier families and hence, of course, community. And finally, I have to again and again and again thank Her Excellency, the First Lady of Zimbabwe, for the great generosity, the great leadership, the great follow-up, and the implementation of what I call it a success story of Merck Foundation programs in Zimbabwe. Thank you very, very much, Your Excellency.
I greatly appreciate the long-term partnership with Merck Foundation and their commitment to transform patient care through building healthcare and media capacity and reshape the public healthcare sector of our country by providing around 100 scholarships to our healthcare providers in many medical and underserved critical specialties in Zimbabwe.
The diploma has improved my clinical and diagnostic skills with regard to respiratory problems. It gave me an opportunity to improve my knowledge of uncommon conditions in our setting. Tackling COVID-19 became easy as I had gained more knowledge on respiratory conditions. The larger community is benefiting from the chest clinic we have at our 2 infectious disease hospitals, Wilkins and Beatrice Road Infectious Diseases.
The course was part of the Merck Foundation Nationwide Diabetes Blueprint program. It involved an online learning platform called Learner, which is partnered with universities in the United Kingdom, including the University of South Wales and the University of Buckingham. The platform enabled students from across the globe to interact and share well-referenced, evidence-based information and articles in an academic forum with the guidance of a tutor. The content was mainly focused on methods of preventing the progression of cardiovascular disease, identifying patients at risk, diagnosis, and management of cardiovascular-related illnesses.
My completion of this course has come at a time when I can be part of public health specialists who make a difference in improving cardiovascular care in Zimbabwe, advocating for equitable access to medicines and services for cardiovascular-related conditions.
thanks to the Merck Foundation Nationwide Diabetes Blueprint Program. This course has benefited me in a great way. Specialist knowledge has helped me to improve the quality of care for my patients, leading to better patient satisfaction and reduced patient referrals.
Thank you so much. I would like to thank the Merck Foundation, the First Lady and the government of Zimbabwe for giving us such an opportunity. Thank you so much.
This is an important day for the media because an informed media has better outcomes. So we know we are growing from strength to strength. An informed media is what is required for better health outcomes. So thank you for giving us and making us the bridge to manage better health outcomes for everyone in Zimbabwe.
We are so humbled and elated at the same time by the philanthropic work being done by our loving, caring and empathetic Amai Vedu, Dr. AUXILLIA MNANGAGWA. We thank you that you have made us realize that we are born for a purpose and to make a difference in this world.
So, Dr. Khaled, I would like to thank you very much for what the partnership has brought to our people, more especially to us here in Zimbabwe. Since we started working together in 2019, I have seen, the foundations growing from strength to strength. And we have met several times in Dubai, where we also met with all the First Ladies in Africa. Yes, and we have exchanged information and engaged in so many ways that we feel our people should, how they can be alleviated in terms of poverty, in terms of health, in terms of education. We have done so much. And the partnership that we are in, I want to thank you so much that you put a lot of effort in my partnership with you to help Zimbabwe.
We learned that we're making history together. We trained the first fertility specialist, the first oncologist specialist, first respiratory care, maybe first diabetologist in the public sector, or endocrinologist, but I don't know, you correct me if I'm wrong, or maybe the biggest number of diabetologists in the public sector. So I hope that this really will make a difference, and I'm so proud of it.